Well, colon cancer is the third most common cancer diagnosed in African American men and women. The incidence is about 20% more in African American community compared to the white counterpart. And not only that, the mortality is even higher. It's about 40% more compared to whites in this country.
When I was first told, I actually had went for my colonoscopy, and my GI doctor had woke me up after it was supposed to be completed, and she informed me that she couldn't complete it because the tumor that was, excuse me, in my colon was too large for her to pass by as far as with the instruments. I cried because I was shocked. I didn't think that's what I was going to hear. I wasn't even thinking about cancer, so when she mentioned it, it was a little shocking.
There is a trend towards increased incidence of colorectal cancer in younger population. If we diagnose colon cancer at an early stage, like from stage 1 to 3, it's highly curable by surgery and getting some chemotherapy compared to stage 4 colon cancer, which is not curable.
I'm the only person in my family that has colon cancer or has ever been diagnosed with colon cancer. So I didn't know anything about it until I was actually diagnosed.
When I first met Nicole, she was with her parents in the room. Obviously, they were all in shock because Nicole was young, not even at an age where screening colonoscopy was recommended at that time. She was otherwise healthy, but had a diagnosis of stage 4 cancer.
I think when I first met her, just as far as how you could connect with someone, I just think I connected with her because it was my first time going through something like this. So I guess the first encounter, I was sold on that first encounter. I just felt that everything would be okay if I followed as far as how she guided me to make sure that I would still be here because I wasn't planning on going anywhere. But it was just speaking with her and her giving me the information.
It is very important for me as a treating physician for my patients to understand what they are going through and to focus not only on their cancer, but also their mental health and overall quality of life. So I think we both achieved that goal well in Nicole's care.
I love her. I tell her that often, and I love giving her hugs, and she's got me to this point, so I just feel like she's a family member, a sister, a aunt, or anything.
So I try to treat each patient as how I would treat my family or friend. And it's important to hear from her that she feels that from me.
She's really got me to where I am today, along with, my belief and everything. I don't think that if I would have had a different oncologist, I don't know if it would be the same relationship. She's great at what she does and great at making me feel like I could get through this. And one thing I know in the beginning that I tell everybody that what I loved about her too is in the first encounter, she didn't even talk about the stage. I appreciated her not doing that because that could have changed my outlook on everything. Even though I'm a positive person, just hearing it for the first time, I don't know if it would have been as well as it is now or it could have changed me dramatically, but I really appreciate her for that.
Nicole is unique in a way that she's a very strong-willed woman and she is willing to do whatever it takes to improve her health and control the cancer. It's not easy for someone with stage 4 cancer to go through chemo after chemo for nearly 4 years without much break. She has a very positive outlook.
My advice would be, as far as going through chemotherapy, speak with your doctor. Understand as far as what your oncologist is explaining to you. Do some research also so that you'll be better informed when you're asking those questions or when you're speaking with the oncologist. My experience with Northside Hospital, I would have to say, is wonderful. The nurses, even the doctors there, they've always been great. I'm always joking around with them when I'm there. I don't think I would want to go to any other hospital other than Northside. They are wonderful. And I would suggest, anyone that's going through it, if you really want to have great care, look to Northside.
The American Cancer Society and the United States Preventive Services and Task Forces made a recommendation a few years ago to decrease the screening age of colonoscopy to 45 from 50. If you're at the age for screening colonoscopy, please go ahead and get that done and do not ignore any symptoms, if it is unusual for you, even if you are at a younger age, do bring it to your doctor's attention and get colonoscopy if it's appropriate for you.